Hello, I'm John Trader, Director of Communications with Right Patient, the healthcare industry's most flexible and scalable biometric patient safety and patient data integrity system, supporting any form of biometrics, including fingerprint, finger vein, palm vein, iris, facial, and voice recognition. Our mission through these podcasts is to help educate, inform, and inspire through conversations with leading professionals for information, analysis, and opinions on the biggest issues and challenges in the healthcare industry. Welcome to today's podcast. Today, our topic centers on single sign-on technology, commonly referred to by its acronym SSO in healthcare. And I'm happy to have Ray Madrill, Senior Director of Innovation and Engineering from HealthCast. Ray joined HealthCast in 1996 following 9 years at Micron Technology in positions ranging from production management to lead applications programmer, developing a number of key production software systems. Ray is a key architect of many of the core HealthCast technologies, frequently partnering with their clients to create innovative solutions to healthcare IT challenges and problems. Now, a little more background information on HealthCast. Currently ranked #1 SSO worldwide by Class Research, HealthCast has focused on meeting the access and security needs of hospitals since 1996. Its SSO solutions are deployed in more than 250 hospitals, academic health centers, and health systems, and in many hundreds of physician practices and large multi-specialty clinics. E-Exact Access, otherwise known as XA, is HealthCast's enterprise-level single sign-on solution suite. The XA suite is comprised of a comprehensive single sign-on solution, 3 different approaches to application integration, and is the only product on the market that has successfully integrated into any application requested by its customers, 2 different client modes, which include standard mode and locking kiosk mode, an EPCS solution for 2-factor authentication at the point of ordering controlled substances, an AD self-service password reset tool, remote approaches to authentication via Citrix or other methods, unique authentication to Epic devices, including Audit Server and Quick Start to automate proximity badge authentication, and smart proximity badge functionality. In other words, only ever use one tap for any badge action. Tap in, tap out, true tap over, tap verification of orders, etc. And Secure Patient Desktop, a patent-pending innovation to enable clinicians and patients to securely share the same device. Also, Quick Access HealthCast is a secure proximity badge access solution for authentication into VDI environments, which include Linux and Windows. HealthCast has an outstanding legacy of innovation for providers. Early innovations include proximity badge software for access to computers and data, roaming SSO sessions, multi-user sessions before Microsoft had the ability to do so, and more recent innovations include patent-pending Secure Patient Desktop, which provides patients the ability to enroll and use patient portals securely on computers shared with providers, and a unique Web SSO plugin for nearly instantaneous integration of websites by customer IT personnel. Productive innovation is a core value at HealthCast. This means they closely work with their clients to identify new features and functions that extend the value that HealthCast solutions bring to each of their clients. HealthCast works with Right Patient for patient identity management in healthcare. HealthCast is also well known for the depth and strength of its professional services, which underpin its customer satisfaction. Its teams have successfully supported numerous E-Exact Access deployments over the past 13 years and helped many of their large and well-known clients transition from one EHR to another. A professional services team is assigned to each customer and continues to serve that customer through its deployment phases and beyond to ensure continuity and knowledge transfer. And now on to our discussion of single sign-on technology in healthcare. Ray, I'd like to begin our discussion today with an overview of the health IT data security environment and talk about the growing importance of SSO solutions as a part of a broad security strategy. Can you please provide an overview of the current health IT data security landscape and describe to us why establishing a secure single sign-on credential is now considered mission critical for the healthcare industry?
Thanks, John. I think there's 3 areas that are important to that strategy right now, and that is data security, workflow and meaningful use. Those are the three important pieces that they need to address. The first one on data security, they need to be, because of the more important is HIPAA increases auditing efforts, and they pursue to ensure PHI is kept secure and out of the view of unauthorized users. The fines are growing, and hospitals boards are now paying more attention to that. So that's one key important aspect of that. The other is just workflow, or the second is workflow. It's more important for users to easily get into systems and then sign off of systems, and they need to change provider behavior to do that. So they need to be able to get into their own unique session so they're not sharing sessions with others. And also it eliminates all those normal typical things with SSO, with sticky notes often placed in public areas and passwords that aren't secure. And the third thing is also meaningful use. SSO increases the speed of adoption of that for using electronic medical records. So that's part of the strategy for meaningful use and giving them access to those investments that they had tied to that. So that's kind of the three, those are the areas that I see are the landscape should be driving SSO in those environments.
You know, it's interesting, Ray. Today I actually caught an article that said more enforcement is likely in the second round of HIPAA audits, which was an article that described that the second round of HIPAA compliance audits is likely going to include more enforcement actions. So certainly this is SSO is a very, very timely topic to have for us today. So I appreciate the response and helping us to frame how it relates to health IT security. Let's move on and talk for just a moment about data breaches in healthcare and their potential impact, which is a very hot topic right now in healthcare. According to a recent report from Accenture, providers could be out over $300 billion cumulatively in lifetime revenue over the next 5 years due solely to damage from cyber attacks. And by 2020, roughly 1 in every 13 patients, which could be well over 25 million people, will have their personal information stolen through technology. Ray, can you tell us what impact are data breaches having on the healthcare industry, and just how a strong SSO solution prevents breaches and their damaging effects?
Well, I think you kind of expressed some of the damages, but one of the ways that SSO is going to improve that, one of the key strategies is you just need stronger passwords for applications. You'll hear that a lot. Well, you needed to have a higher, upper, lowercase, mixed combination of special characters. And that's difficult if you have lots of applications and for a user to want to keep track of that and remember it. So without an SSO solution, your tendency is to not increase those passwords to a stronger level. So that opens those systems up to being hacked if you don't do that. So SSO and the way it's implemented within Exact Access makes that easier to do that. And also another important thing is if you don't have a solution that's convenient for the users to quickly get in and out of systems, then they tend to either leave applications open, exposed, where other users can internally just view it, not only externally from a cyber attack, but they can just go view it if they don't make it easy to quickly get in and out of the system. So those are some of the things that we believe a good SSO solution like Exact Access provides in those kinds of environments.
It's interesting that you bring up convenience, Ray, because that's another area that we see a lot of healthcare providers seeking as far as a patient identification solution. So it makes very logical sense that they're seeking that in an SSO solution as well. And that kind of leads into our next question, which addresses workflow. I want to address single sign-on impact on employee workflow. And I would imagine that some healthcare providers are probably apprehensive about adopting a single sign-on solution for fear that it may negatively impact employee workflow and also negatively impact productivity. A couple of things that you touched on in the answer to the previous question. Can you shed some light on this and help us to better understand the impact of an SSO solution on provider workflows by explaining how the implementation of an SSO solution impacts provider workflows and why this is important to patient safety?
Well, I think there's three areas that the workflows improve. The first one is productivity. The second important one is convenience. And then also the third is patient focus, or the clinicians focusing on the patient. So on productivity, our Exact Access solution, we believe it improves that productivity, that where physicians using the system, they believe they can, save 40, 45 minutes a day by using the folks that are using that have it implemented could save that amount of time. So that can mean they can see 2 or 3 additional patients, and they can spend that time for other purposes, teaching or research and stuff. So that's important with that. And how does that lead to safety? If you have more time and you're not stressed, you're focusing on the patient, and that's kind of that third point. But also in the second point, convenience. If the system is not convenient to use, using something like, if you use with our system, you can plug in different types of authentication. One of them is what typically is used prox card functionality. That allows physicians to not be distracted because they can just quickly get in and out of the system, and they're not paying attention to the patients, and they don't have to focus on the computer. They can securely get into the system and not be on a system that's already logged in or forget about it, or so that leads to patient safety. So they're not actually on the wrong record by just walking to a computer that has the wrong patient up and not noticing it or not realizing it. So they can just focus on patient care at that point. That's the crux of it, is having that convenience and productivity and knowing once you use that, either a proximity card or a biometric badge to authenticate and get into the system, that you are ready to go with that patient and focus on that patient care at that point.
Great. Thanks, Ray. I appreciate the feedback on that. Something that just popped in my head on a side note, based on your experience and your observations in the healthcare marketplace, I'm sure you probably have a chance to actually see ground zero at a lot of hospitals across the country. And I was curious to know if you felt there needs to be a stronger effort from healthcare facilities to help their staff understand the role they play in keeping patient data safe. In other words, do most hospital cultures that you observe include an understanding of just how critical protecting patient data actually is?
The folks that are on the ground giving care, they're focused on care, and they're not focused on the computer security. And that's one of the reasons that the system needs to accommodate that. It needs to make that easy so they don't have to worry, so they can focus on what's important, and that's the care of a patient, and that is their focus. And so sometimes these, without an efficient sign-on system like Exact Access, then they're taken away from care. They're taken away from that. They're focusing on, well, I got to get through this system. And also productivity is important, obviously, with the rising costs of care. So they're trying to do that efficiently. So that's what I see, is that they're concerned, but that's a secondary concern, and the system needs to handle that. That's the environment that I see typically, and they just need that system to work fast and conveniently and quick, and they really want it to be secure. So that's what Exact Access provides for them.
Okay, thanks, Ray. Let's discuss the impact of an SSO solution on e-prescribing of controlled substances, otherwise known by the acronym EPCS in healthcare. Most of our listeners are probably aware that prescription drug abuse is a very serious problem in our country. As a matter of fact, it's estimated to cause approximately 22,000 deaths per year, more than cocaine and heroin overdoses combined. However, e-prescribing is changing healthcare by demonstrating that health IT has become a critical component for the efficient delivery of medicine and cost-effective patient treatments. With the volume of controlled substance prescriptions on the rise, increasing from 10% of all prescriptions in 2010 to a projected 30% in 2015, what role does a secure SSO solution have to support efficient and secure EPCS?
E-prescribing certainly makes it simpler and more accurate for pharmacists to deliver the correct medications in the correct doses. This is really important, like with IV solutions or controlled substances, such as narcotics, and prescribed to help prevent medication errors and unnecessary complications or even death. So how does SSO help that? Well, it's kind of an indirect component of that, and that's just assuring that the proper authentication and verification of the identity of that physician ordering that is the right person. And within our solution, there's other components we provide to actually do that EPCS authentication, whether it's biometrics or tokens or that type of component, which are not directly, but it's important to have the right person into that system when they first log into it, when they get to the order entry screens to order. You want that first level, and then the second level you want another verification to meet the controlled substance rules as far as DEA is concerned, the type of technology that meets those requirements to actually make that entry at that point.
Are audit trails a part of that, Ray? Is it a question where SSO provides an irrefutable audit trail that's an important component of EPCS?
That is, and it is that you bring up a good point. That is a function that we do provide within our solution is audits. However, most of the clinical applications do have their own internal audits to meet some of those requirements, but that can be added to with our audit functionality to provide that an additional layer of control around who logged in and then who ultimately did an authentication.
Okay, thank you for the feedback on that, Ray. I'd like to talk for a moment about form factor when it comes to implementing single sign-on solutions. By form factor, I'm referring to the size, configuration, or physical arrangement of single sign-on devices. Ray, can you tell us what are the different form factors for SSO solutions, and what is the impact of using biometrics such as a fingerprint with an SSO solution to ensure patient safety?
So there's various form factors of devices that can be used. We focus a lot on proximity card within our solution, and there's various USB devices sizes that can be utilized, some that are small thumb-sized devices that we plugged in. Also, there's keyboards that have biometrics and proximity embedded in them that can be utilized. And there's other devices too, whether it's voice or iris recognition, that can be utilized within that system. A lot of that depends on the deployment areas where those need to be utilized, whether you have room for on carts or on desks or wherever the computers are at that can be used in that. So there's a number of different options there.
Okay.
Hey.
I wanted to, Ray, with this last question, go into a little bit more about patient safety, which you've actually answered in the context of some of the other questions that we posed during the podcast. Speaking of patient safety, can you give us sort of a recap and include any additional points that you may not have previously in giving us kind of an overview of how successful SSO implementation increases patient safety? I know, again, we've talked a little bit about it in the podcast, but maybe you can recap what those bullet points are in terms of how SSO helps patient safety, just for the benefit of our listeners so they can really understand sort of how the rubber hits the road with an SSO solution when it comes to increasing patient safety.
I think HIPAA regulations, which are really about sensitive information, your health information, and it's important that that's protected, and that's part of one of the things that we help with the organization do in preventing that unauthorized viewing of PHI. The other thing that's important is improved security and convenience around accessing applications, which helps to, if we get the right user to the right application, then that, or that they have access to particular functions in that system. They're not either entering incorrect notes or orders for a particular patient, which improves safety there. And another area is physicians have more time to focus on patient care and seeing more patients. That in itself improves patient safety, where they're not distracted or not thinking about the care they're doing at that point. It gets annoying when you can't get into a system. We all have experienced that at different points, and that distracts you. And it's hard to talk to somebody when you're trying to type in a password, especially if it's complex, and you're not focused on the job at hand, the most important one, which is the care at that point. And then just that improved workflow and productivity, accessing the clinical desktop is another aspect of that for efficiency, so that you're not tied up dealing with the system to get to that point in the system where you need to provide that information. So I think that's kind of really the overall components of that we've talked about, and improving the data security, improving the workflow, and in addition helping with meaningful use. So those were some of the main pieces that we discussed today.
You actually, thank you, Ray. I appreciate the recap. You bring up a couple of pretty interesting points, and that is, I think, number one, that when you talk about implementing an SSO solution in healthcare, I think a lot of people tend to think that encompasses access to an EHR system and an EHR system only. But I heard you say earlier that HealthCast's SSO solution can actually be applied to any internal computer system that might be for billing or it might be for diagnostics when it comes to medical devices. And that's really the overall big picture when it comes to increasing security in healthcare, is making sure that you're addressing each and every platform that an employee has access to through the implementation of a secure SSO solution, which it sounds like your solution has the ubiquity to be able to do that. So that's a really important point. And number two, which is the time that is saved. And I think that's an important point that deserves another mention, only because you mentioned earlier the ability to see a couple of extra patients during the day because you've, through productivity tools such as HealthCast SSO solutions, you've been able to save that couple of minutes or period of time where you're able to squeeze in an extra patient or perhaps address a concern from an existing patient that you may not have gotten to during the day. That's a big thing for healthcare. This is an industry that competes for patients, where patients have a choice of where they want to go. And it certainly has been demonstrated through the podcast that implementing an SSO solution really works to a provider's advantage, especially when it comes to providing them that extra productivity and time to be able to do some things that they otherwise might not have had the chance to do. So those are really important points, and I appreciate you bringing them up during the discussion on that question. And I'd like to take a moment and thank Ray and HealthCast for offering their time and insight on the use of single sign-on technology in healthcare, and also for providing us with his feedback during our discussion today on some of the additional questions. For more information on HealthCast, you can visit their website at www.gohealthcast.com. That's GOHEALTHCAST.com. Or you can follow them on Twitter under the handle @HealthCastInc. and like their Facebook page, which you can find by typing HealthCast Solutions in the Facebook search field. Thank you so much for your time today, Ray.
Oh, thank you, John.
This concludes our podcast for today. We hope that you enjoyed the topic and our guest, and encourage you to tune into future podcasts where we interview industry professionals on topics that relate to healthcare and the biometrics industry. For a full list of all our podcasts, please visit our podcast page at www.rightpatient.com/healthcare-biometrics-podcasts. Thank you, and see you on our next podcast.